Hello, everyone. My name is Logan Lynch. I'm a doctor of physical therapy and pelvic floor physical therapist. And I am here today. We are doing a pelvic floor question and answer session today. So I have a list of your most burning questions all about the pelvic floor. And we're going to go through these and I'm going to give some answers to these. I have my trusty pelvic floor model for some visuals as well. And if you have any additional questions after this, feel free to comment them down below and we'll do a part 2. So a little bit of background on me, if this is your first time here. I have a private practice located in Iowa, and I treat a variety of conditions and clients. I do online coaching, I do in-person sessions within my practice, treating pelvic pain, urinary incontinence, constipation, pregnancy, postpartum fitness and wellness, and all of the above. And I absolutely love what I do. So I love chatting about this, and I'm so excited to answer your questions and give you some more information just about the pelvic floor. So maybe you can determine whether, maybe you have pelvic floor dysfunction or an issue, or what's been going on with it. Maybe you haven't gotten answers. Maybe you're thinking about pelvic floor therapy and aren't quite sure about it. Hopefully this gives you some peace of mind today, or just some education and some knowledge about what the heck is going on down there. So let's get right into it here. Okay, question number 1. What is the pelvic floor and where are the pelvic floor muscles located? Great question to start off with. That is why I have my visual. So the easiest way to explain what the pelvic floor is, because there is more than just muscles involved. We have ligaments and fascia and things that contribute, but typically the best way to kind of visualize what's going on is as a group of muscles. So your pelvic floor is a group of muscles that sit within your pelvis in this bowl-like fashion. So in this circular pattern, they attach from your pubic bone to your hip bones to your tailbone, all the way around. And as you can see, it's kind of like a bowl-like structure. I typically like to refer to it as like a trampoline-like structure because of its function, because of how we need it to relax and lengthen and kind of spring back up and contract and have a full range of motion, which I'm sure we'll talk about a little bit more. So they're located within your pelvis, in between your hip bones and attaching to those structures. So there are lots of different functions of the pelvic floor muscles, including support of the organs of your bladder, uterus, and rectum. They control your sphincters, your anal sphincter, your urethral sphincter, so they keep things inside when we don't want them to come out, and they relax and release when we are having bladder and bowel movements. So that is a quick and dirty explanation to what the pelvic floor is. What are the functions of the pelvic floor? So kind of already got into that a little bit. So support, sphincter function, so they are controlling your urethra and keeping you continent or relaxing, controlling your anal sphincter, keeping you continent. They play a big role in sex and the orgasm. So contractions of the pelvic floor muscle, that is what that orgasm is. And they need to be able to relax and lengthen in order to not have discomfort or pain with intercourse. And then their contraction, obviously, from the pleasure standpoint as well. So they also are what's considered a sump pump. So from the lymphatic system, they are pumping. Their contraction pumps, keeps the lymphatic system going, and they play a big role in that as well. So lots of different functions. And then just stability. So because of where they sit inside your pelvis, they play a big role in just providing stability to your central pelvis, right? You have your upper body up here, your trunk, the rest of your spine, you have your legs and appendages down here, and this is kind of that center of your core. Your pelvic floor is a part of your core, so they give a lot of stability to your body. What are pelvic floor disorders? So really the big overarching term that's usually talked about is pelvic floor dysfunction, and they are any real issues or things going on that involve the pelvic floor. So that could be urinary incontinence, which is the involuntary release of urine. So when you're jumping or coughing or laughing, sneezing, running, any of those things, if there is a release of either fecal matter or urine, that is what's considered incontinence. Urinary incontinence, bowel incontinence, not being able to hold your bowels back in those situations, pelvic pain, So that could be pain with intercourse, that could be pain with orgasm, pain with penetration, either during sex or something like a tampon or a menstrual cup. Any insertion of anything is uncomfortable and limiting. So those are some of the most, common ones. There's like urinary frequency, where you're going significantly a lot to the bathroom, or your bladder's waking you up multiple times at night. There's urgency, where you feel like you have that urge to go to the bathroom and you have to run and rush there, or urge incontinence, where you don't quite get there and you have some leakage. So there's a lot of different things that can be going on that have some sort of relation, or often have a relation to how the pelvic floor is functioning. Which brings us to number 4, what causes pelvic floor disorders? And this is a very broad question because there's not a perfect answer. There's a lot of things that can contribute to pelvic floor dysfunction happening. One of the most common, assumptions or things going on that typically bring out some of these pelvic floor disorders is pregnancy and being postpartum. So that is where there's a big interruption to the core system, to the pelvic floor. And because of that, it can impact how they function afterwards without kind of proper progression back in exercise, without proper rehab. And because of the body changes and the postural changes during pregnancy, sometimes your body just develops these compensations or different ways of moving or breathing that eventually kind of impact your core system, and they don't love that anymore. Pelvic floor muscles aren't functioning the way we need them to. So some things that can, I'll say, contribute, because sometimes we don't have a perfect correlation or cause of like, this is what caused your pelvic floor disorder. Like oftentimes there's multiple things going on that maybe over time started to lead to this dysfunction. So that could be things like stress and anxiety. So a big impact on your nervous system in those situations. And your nervous system, obviously plays a role in everything, but your pelvic floor muscles take on a lot of that a lot of the times, especially in terms of chronic tension. When we are in a chronic state of stress or anxiety, and we kind of get in this loop of our body responds to that stress by clenching and tightening and holding. And then we don't have a way out of it. We kind of get used to that. So then those muscles develop this chronic tension where they're kind of always living in that state of tightness and tension. Things like posture and how your exercise form, how you're moving, how you're breathing. Your breathing mechanics can make a difference if we have kind of a dysfunctional breathing pattern, meaning when you breathe in, if your belly sucks in and your belly pushes out as you exhale, that's actually backwards of how we want to breathe. And a lot of people don't know that they're doing that until they try and take a deep breath in, or someone asks them to pay attention. Because obviously you're still breathing and you're doing it correctly in terms of what a breath is supposed to do for your life, but the mechanics of it may be altered where those pelvic floor muscles start to get irritated and they are not moving with and functioning in the way that they work best, in the way that they function best. So there's not a particular answer to that. With pregnancy, there is, again, a lot of alterations afterwards where a lack of core strength, a lack of stability, a lack of just strength in general, really tight hips can lead to pelvic floor dysfunction because of just their relation to the pelvic floor. If you have any tearing with a delivery or even a C-section, but the tearing that can, depending on the degree of a perineal tear, it can impact the pelvic floor. So there's scar tissue there. There's tension that develops. There's, a differing way of moving now because there's that extra, scar and tension there that is not addressed. So that can play a role in causing pelvic floor dysfunction down the road. And it may not happen right away. Sometimes this is years of patterns and habits happening, and some of those symptoms don't come out till later on in life when there's other factors involved like aging and tissue changes and nutrition and lack of general activity. So there's so many things that can compound, and that's why some people, they have kids and then years later they have pelvic floor issues and they didn't see anyone or ask about it early on because they didn't think they needed to. But over time, over years, things change and your body just kind of gets sick of it a little bit and they can't tolerate it anymore. Number 5, how do I know if my pelvic floor is strong or healthy? Great question. Really, I mean, one kind of indication is a lack of symptoms of these other disorders. And that doesn't always mean, like that it's strong and healthy, because again, some of these things can happen down the road. But if you're not having any of like continence issues or having any pain, and you're able to just function and work out and do all the activities that you want to do and nothing's happening, then your pelvic floor is likely functioning the way we want it to. But with an asterisk, I'll say, we also need to tune into and be preventative about these things. So sometimes, again, it takes years or like a compounded effect of things showing up later. So really, the best short synopsis I can give in this video is, can you fully relax your pelvic floor? Can you fully contract your pelvic floor? And when you breathe in, does your pelvic floor expand and drop? Does your belly expand? Do your ribs expand? And when you breathe out, do your ribs come down? Does your belly come in? Does your pelvic floor rise back up? So the first step is creating awareness of what your pelvic floor is actually doing. Is it always like this? Is it always contracted and tight? Or can you feel it relax? Can you feel it contract? Does that contraction feel strong? And can you sit somewhere in the middle when you're not thinking about it? So that ability to find a full range of motion of your pelvic floor is a good place to start in terms of creating a healthy length tension relationship within the tissue. And then we kind of tie that to activities. And is your pelvic floor turning on and contracting and reacting the way that we want it to prevent some of those symptoms happening? So that's a good place to start, is deep diaphragmatic breathing and seeing what your pelvic floor is doing. Can you feel it fully relax? Can you feel it fully contract? And that's a good indication that things are going pretty well. Number 6, what can be mistaken for pelvic floor dysfunction? I would say like things like, even like constipation. So sometimes there's medication given and there's lots of testing done and trying to figure, nutritional changes. And yes, nutrition plays a huge role in constipation, but sometimes I see clients who go through this whole range of testing and try all these things and nothing has addressed their constipation. And it was really the pelvic floor all along that was not able to, it didn't have a good length, it wasn't coordinated well, so they weren't fully emptying, they weren't able to have frequent bowel movements, and that led to constipation. And so that whole time, that wasn't addressed. So nothing else is working, and then they finally come to pelvic floor therapy and then realize, okay, it really probably was the pelvic floor that was driving this constipation. So I would say there are things that are not always tied to the pelvic floor when they should be, like constipation, bladder incontinence. A lot of times there's just a medication given thinking that it's like your bladder that's overactive or bladder spasming, when really it's because your pelvic floor is not able to relax and it's causing a lot of tension within the area. So your bladder is like not able to expand. So then you're going more frequently, or that signal comes a little bit earlier. So those would be a couple examples of not necessarily what would be mistaken, but what are where the pelvic floor is commonly missed as a root issue. And like there's all these other medical type of interventions done first. And really, if we address the pelvic floor back then, some of these things could have been avoided. Number 7, when should I seek help for pelvic floor issues? My overarching answer is whenever you want. Because there are some people who deal with these issues and they really don't care that they have a leak here and there with the jump, and they just kind of push through it and it really doesn't bother them. And that's totally fine. It's not my place to say that you have to fix it and that you have to address it. But for the people who it's impacting their quality of life, those are the ones that's when they are starting to come in, is when it's significantly changing how they're moving, what the activities that they're able to do, because they don't have the confidence anymore, because they don't want to wear a pad, they don't want to pee, they're nervous being in a group class. or, in terms of like pelvic pain, like now it's affecting their sex life and their relationship. And so that is a time when a lot of people are coming in for those pelvic floor issues. But you don't always have to wait until it gets to that point. You can always get an assessment to figure out what can you be doing preventatively. Just learn. I mean, the biggest thing is like when we're little, we don't learn proper bladder and bowel habits. We don't learn how to relax our pelvic floor. We don't learn how to tune into that, how to brace our core correctly. There's a lot that just we're not taught. And so we develop bad habits over the years. And then when we become adults and older adults, like then some of these things come out that maybe started from a long time ago. So as soon as you're ready, as soon as you want to, as soon as you feel like it's an issue you want to address or it's impacting your quality of life and you don't want to deal with that anymore, that's a great time. Number 8, is pelvic floor therapy painful? It is not painful, or it shouldn't be, I'll say. And really the best way to kind of interpret this and transfer this to what this may be addressing or talking about is the aspect of an internal assessment in pelvic floor therapy. So for those of you that are not familiar with pelvic floor therapy, there is a tool of assessment that we can do, and that is an internal assessment. This is a little bit different than a pap smear, or very different than a pap smear, but than like a gyno exam. So when we do an internal assessment, the only tools we use is a gloved, lubed finger. That's it. So that is what helps us assess the pelvic floor muscles from a different perspective, from a more manual perspective, and we can put pressure on muscles and feel where those muscles feel tight. So this assessment can be done intravaginally or intrarectally. So for female patients, can do either. Obviously, male is just rectally, and the assessment itself is always, or should be always, optional. So if it is not something you're comfortable with, after explained by your provider of kind of the procedure, why we're doing it, what we're looking for, if you are still not comfortable with it, a great provider is still going to be able to treat you. So you should never feel pressured to do it. You should never feel coerced into it if it is not something, for whatever reason, because there can be various reasons, that you are not comfortable with. And there are multiple other ways that we can still address a pelvic floor issue without that piece of it, or there should be. So if there's someone who feels like they cannot treat you without that, there may be another provider who can, and to search around and find someone who can do that. So in terms of painful, now someone who has pain with intercourse or pain with insertion, when we do that assessment, we're trying to figure out where that discomfort's coming from. So as we assess, starts very gentle, and we're not trying to cause pain. But when we press on a muscle that is causing some of that normal discomfort, it may be a little bit tender, but then we come off of it. We're just trying to get a gauge of how tender those muscles are, but we're not going to push much past it because we don't want you sitting there in pain. So that's where the whole thing shouldn't be painful. Otherwise, we need to back off a little bit, but there may be points where we touch on a muscle that's a little bit more tender, and then you communicate that to us and what you're comfortable with, and then we release that pressure. So hopefully that answers that question. Number 9, I'm already doing Kegel exercises and they're not helping. Why would pelvic floor physical therapy help? Love this question, because it's one of the most common misconceptions about the pelvic floor in general and pelvic floor therapy. So if you're already doing Kegel exercises and they're not helping, then it's likely that the Kegel exercises are not what you need. So despite what a lot of healthcare providers or social media say, Kegels are not the answer to everything. And I feel like now it's kind of swinging the other direction, but like they have a role for some people, but they don't cure everything. They're not a cure-all, because a weak pelvic floor is not always the problem. Like I mentioned before, there's a lot of other things, how you're moving, breathing, your hips, your glutes, your feet, your shoulders, your back, your spine. Like there's so much that can contribute to issues. And Kegel exercises do not address all those things. A Kegel exercise is a contraction of your pelvic floor. That's it. And if we're doing them wrong, if we are not translating that into how they should be working, without thinking about them, that's where they cannot be helpful. And especially for someone who is in the tension state, who has chronic tension within their pelvic floor and is holding tight all the time, a Kegel exercise typically just makes that worse, because the problem is not the contraction, it's that we're not relaxing. We're never letting that contraction go. And that's where some of those issues come up. So why would pelvic floor physical therapy help? Because pelvic floor therapy is not just teaching you how to do a Kegel. Not even close. A lot of times, most of us are probably telling you to stop doing Kegels. So pelvic floor physical therapy is going to help you determine what is going to be helpful. Why is a Kegel not working, and what instead is going to be more helpful for you? Number 10, I'm planning on having surgery for my condition. Why would I need pelvic floor physical therapy? Another great question. Pelvic floor therapy is great in multiple ways in relation to surgery. One, sometimes it can prevent surgery. So if you're still not sure, don't want surgery, you don't have to get surgery. Even if your doctor said this is the only way to fix it, may not be the case. Some people, surgery is a great option and is the best option at that point. And sometimes that's just what people want. They don't want to go through weeks of therapy, and that's totally your choice. But in terms of, okay, you've made the decision to have surgery, prehab and rehab after is super important. So we can make sure we're addressing things that maybe caused the problem in the first place. So if we are not bracing correctly, if we have a really tight pelvic floor, if our breathing mechanics are off, and we get surgery to address like a bladder sling, we lift your bladder, or fix prolapse, or whatever the surgery is for, and then we don't fix any of the issues that caused it in the first place, sometimes the effects of that surgery or the positive impact of that surgery may not last as long, and you get symptoms again 5 years later, 10 years later, because we're still doing the same bad habits and the same things that contributed to the problem in the first place. So going before you have surgery to learn good mechanics, to learn healthy pelvic floor habits, and then afterwards to address any scar tissue, any ongoing tension, get progressively back into fitness and exercise without aggravating things and correctly and efficiently. That's where pelvic floor therapy can step in and be super, super important and helpful. Number 11, my mom, aunt, grandma, and sister all have bladder leakage or pelvic prolapse. Does that mean that there's nothing I can do to prevent it from happening to me? Short answer, no, that's not what that means. I hear this a lot of, my grandma had it, my mom had it, and it's just like runs in the family. From a tissue perspective, maybe especially if there's like a genetic tissue disorder going on, like, yes, that can contribute or make it more likely to maybe have pelvic floor dysfunction, but it doesn't mean there's nothing we can do. There's a lot we can do. And, it would be even more important for you to go to pelvic floor therapy or address those things because you are more like at a higher risk of developing some of those dysfunctions. So that's my short answer for that is no, there's nothing we can do. There's a lot we can do. And in fact, I highly encourage you seek that out early to develop good habits early on. Number 12, my doctor told me that this is just a part of giving birth, that it's inevitable I will have bladder leakage. Will pelvic floor therapy help? Yes. Again, short answer, I could go on and on about this, but short answer is yes. Okay. Is it common for people who have had babies to have a lot of these symptoms? Yes, because of the giant interruption to the normal system that's going on. But it's not inevitable that you have to live with bladder leakage. Absolutely not. And please unsubscribe from that mindset. And I'm trying to be out here getting that mindset out of healthcare providers so that there is more referrals to pelvic floor therapy and there's more hope that there is help. So despite what anyone told you, it does not have to be inevitable, and pelvic floor therapy can absolutely help in most cases. Number 13, isn't pelvic PT just for women? No, it is not. Yes, that is probably the most common clientele, especially for me, that I see. But it is not just for women. Men can have pelvic floors. They have a pelvic floor too. Their anatomy obviously is a little bit different. So the muscles, there's some variation in the muscle structure, but they have a lot of the same muscles. It is set up very similarly. and the same functions in their body as well. So they can have incontinence, they can have pelvic floor tension, they can have bowel issues, they can have hernias, hemorrhoids. Those are common ones, especially in men as well. So pelvic floor therapy can help men and women. Some providers are trained to treat both, some are not. But so just something to seek out, and definitely want to build more education and awareness around pelvic floor therapy for men for sure. Number 14, will I get exercises to take home with me? Here, yes. In a practice that cares about longevity and making you a more confident and active and strong person, yes, because that's a huge piece of it. It's not just about what we're doing here. It's not all hands-on on the table work. It is we're up and moving, and we want to reinforce good patterns and good habits and strengthening and address those things. So yes, you'll always have things to be working on your own outside of those sessions to reinforce those things, to get reps in and to continue to progress forward. Last one for today. Number 15, I've been told by many doctors that my pain with sex is all in my head. How can pelvic floor physical therapy help with that? First of all, I'm very sorry that was the message that you received, because that's really discouraging to hear as someone who's struggling with it. Not myself, but if you were that client and you're the one struggling with it and you're communicating this to a provider, and that's what they say back to you, I can understand how frustrating and disappointing that is when you went to them for help. And it's not true. Yes, there's a component of the brain and nervous system in terms of how your body's functioning, but it doesn't mean it's all in your head. And pelvic floor therapy can help address why you're having it, where it's coming from, why, what factors contributed to in the first place, and how are we going to resolve it? How are we going to take steps forward to get to work towards that? And especially with an issue like this is typically a very multidisciplinary approach, just depending on your history and the client. So if there is a trauma involvement, any history like that, like typically mental health is a big component, and like working through those emotions, birth trauma, people to help address those things and work through and process those emotions and feelings around that play a big role in that, into how your body's going to respond to exercise and to pelvic floor therapy. So a lot of times there's multiple providers involved in these cases, and in order to give you the best care possible and to be addressing all of the things that we need to take those steps forward and get you more comfortable in that situation. That is all for today. So that is our pelvic floor question and answer. Again, my name is Dr. Logan Lynch, pelvic floor physical therapist, and thank you so much for joining me today. Make sure you subscribe to my page for more updates and more pelvic floor therapy and pelvic health information, and submit any questions that you have after this Q&A, and we'll do a part 2.